If you've been following this channel, you'll know that I've been talking about chronic pain, persistent symptoms, and mind body syndromes, basically conditions where the nervous system and the brain play a significant role in actually generating or maintaining symptoms. And in my previous video, I talked about how the brain and the nervous system can actually learn to produce very real physical symptoms, even when there isn't ongoing tissue damage or illness. Today, I want to talk about something that can be incredibly important in understanding why symptoms sometimes persist, even when we're doing everything we can to get better. It's something known as the 7Fs, which is a concept developed by Dr. Howard Schubiner that I personally find particularly useful when working with people living with persistent symptoms. Now, the 7Fs are common reactions that many people naturally develop when they're living with pain, fatigue, dizziness, perhaps digestive problems, or other ongoing symptoms. And the important thing to appreciate is that these reactions are actually completely understandable. They're not a sign of weakness or failure. In fact, they're often exactly what most people would do when faced with frightening and unexplained symptoms. The challenge is that these responses can sometimes unintentionally signal danger to the brain and the nervous system, and as a result, contribute to the ongoing cycle of symptoms. So let's take a look. So the first F is fear. When symptoms appear, particularly if they're intense, unpredictable, or medically unexplained, fear is a natural response. You might wonder, what if something is seriously wrong with me? What if something's been missed? What if this gets worse? What if I never recover? And so on. So fear makes sense because symptoms often feel threatening. Now, the problem is that the brain is constantly assessing danger, and if symptoms become associated with threat, alarm, or catastrophe, the nervous system can become increasingly vigilant. And in some people, this heightened vigilance can contribute to increased symptom generation, creating a cycle where symptoms trigger fear, and fear amplifies symptoms. The second F is focus. When something hurts, it naturally captures our attention, right? We begin monitoring the body, checking, scanning, looking for changes, asking ourselves, is it better today? Is it worse? What's this new sensation? Again, this is completely understandable. But the more attention the brain devotes to symptoms, the more prominent those symptoms can become. And research consistently shows that attention influences perception. The brain tends to amplify what it believes is important. And if symptoms become the primary focus of attention throughout the day, they can become increasingly noticeable and intrusive. The third F is fighting. Many people find themselves locked in a constant battle with their symptoms. Every sensation becomes an enemy. Every flare up feels like a setback. The body becomes something to struggle against. And the difficulty is that a state of ongoing struggle often keeps the nervous system activated. And when the brain perceives a constant battle, it may continue to interpret the situation as threatening. And paradoxically, the harder we fight certain symptoms, the more attention and importance we may inadvertently give them. The fourth F is figuring out. Now, people with chronic symptoms often spend an enormous amount of time trying to solve the puzzle, searching online, reading articles, comparing stories, looking for the missing explanation. And of course, seeking answers is entirely reasonable. The problem arises when symptom analysis becomes constant. The brain remains focused on the question, what's wrong? What's causing this? What have I missed? And this ongoing search can unintentionally keep attention anchored to symptoms and reinforce the sense that danger is still present. The fifth F is fixing. Many people understandably make symptom reduction their full-time job, trying new supplements, new diets, new exercises, new treatments, new strategies. And again, there's nothing wrong with seeking help or pursuing treatment, right? The issue is when life becomes organized entirely around eliminating symptoms before living can actually begin. That means the brain can receive a powerful message. These symptoms are dangerous. I can't be okay until they're gone. And that message can sometimes strengthen the brain's perception that a threat remains unresolved. The sixth F is frustration. When the symptom persists, despite our best efforts, frustration is almost inevitable, right? People often think, why isn't anything working? I've tried everything. I'm exhausted by this. Now, frustration creates a tension, stress, and often a heightened focus on the very symptoms themselves. And over time, this emotional struggle can further contribute to a nervous system that remains stuck in protection mode. Finally, the seventh F is forlornness. This is a sense of hopelessness and despair or discouragement that can develop after months, sometimes even years of symptoms. People may begin to feel defeated. They stop believing improvement is even possible. They lose trust in their bodies. They lose trust in recovery and maybe even lose trust in healthcare professionals. And this can be one of the most painful parts of living with chronic symptoms, not because hopelessness causes symptoms, but because it can narrow a person's world and make it harder to engage with the very experiences that actually help the nervous system relearn safety. Now, if these reactions can contribute to symptom persistence, what should we do instead? Well, the answer isn't to suppress fear or force positivity or pretend symptoms don't exist. It's about gradually changing our relationship with our symptoms, becoming less frightened by them, paying less constant attention to them, reducing endless monitoring and analysis, stepping out of the battle essentially, re-engaging with life wherever possible, and helping the brain learn that symptoms, while uncomfortable and often really distressing, are not always indicators of ongoing danger or illness. So, for many people with neuroplastic or mind body symptoms, this shift can become an important part of recovery. Now, it's important to remember that the seven F's are normal human reactions to symptoms. The problem is that these reactions can sometimes unintentionally reinforce and maintain the brain's danger signals and contribute to symptom persistence. Understanding that cycle is about recognizing a pattern that may offer a different path forward. Now, if you found this helpful, please like, subscribe, and share it with someone who you think might benefit. And hopefully, I will see you in the next video. Thanks for watching.